My grandma actually adopted me, and I just saw how unfair and unjust the foster care system was and child welfare system was. That's why I decided I wanted to become a social worker. Most of the children we serve are medically fragile children, from having severe disabilities to having autism and behavioral issues. I feel like I have a voice. I feel like I can be a voice for these children, and I'm able to really get in there and help these families advocate for these children.
Whenever I'm having a down day, I keep some Daisy nominations that I've gotten in the past. And I like to read some of them sometimes if I'm ever being discouraged. And they said, Michael took care of my mom on day shift. Mom was having a lot of vomiting and nausea. He did not dismiss my concerns and responded with the help that she needed. So just kind of going above and beyond. Sometimes, patients present with very subtle cues, but it's such a fulfilling career caring for others and humanity. We're a resilient group. We've stood the test of time in the past. We're still here today, and we're going to be here tomorrow.
Being a nephrology nurse and being able to, tell someone while they're getting dialyzed, hey, I'm taking you off the machine. I just got a phone call from the transplant center. There's a kidney waiting for you. That's an emotional experience for everyone. And in that area of expertise, I have the ability to impact the patients' lives and their families as well through so many different stages, whether it's the start of dialysis, death, or receiving the gift of life, which is a transplant.
Patient care is global. It's not just the patient, it's themselves, it's also their family, and making sure that they have an advocate. In my role as a staff nurse, I am a weekend position staff nurse at the Level 3 Trauma Center hospital in our area. I just love helping people. When I come into work, this is not a good day for them. Nobody wants to be in the hospital. Nobody wants to be sick. Nobody wants to be in pain. And so if I can just be a comfort for them and provide the care that they need and be the eyes for the physicians and the providers, that's my motivation.
I wake up every day, I want to come to work. I want to come here to take care of my patients, to make sure they are okay. It's in me. I know I cannot help everybody, but the little that we can help, we will try and help them. For a few weeks now, we've been going from one community to another to do the health clinic. So I send the nurses to go there. So they take people's blood pressure, and I buy a lot of blood pressure monitor, and I was giving to the people that have high blood pressure. Then we tell them to go to the hospital to follow up with the doctor.
My profession really brings me to the bedside of patients who have chronic life-limiting illnesses and or terminal illnesses. So I work with patients and families through the journey that they face when going through end of life. When you meet families, whether they're at the best time of their life or the worst time of their life, you have to be patient with them. And you also have to show empathy, especially for someone who's going through a challenging time. And I've become very good at that. I'm very good at establishing a therapeutic rapport with patients. In fact, in my profession, some of the most difficult consults come to me. Pediatric patients who are facing terminal illness, but they're young. And it's because I have the patience and the empathy and the compassion to walk them through that journey.
I take the responsibility for being the first nurse and the first woman in this role very, very seriously. Our healthcare workers were warriors, and I want to show up and advocate and be there for them and support them in whatever way I can. But I also want them to know that I am out there on a different front line, doing what I can to make sure they have what they need to provide that care so they can continue to be warriors.
The biggest thing that I want to look back and be able to say is that I was able to have an impact and make a difference, but not only for the patients, but also now for the staff, and even bigger than that, the organization. I want to be able to look back and reflect and say that from when I started my career to when I ended it, I can truly say that I've made things safer and made a difference.
My superpower isn't so much about what I do and the care that I provide. It's about the support that I'm able to give to others. It's about the vision that I'm able to give to others to develop and embrace and to grow their own superpower. That's what I do as a mentor. That's what keeps me in this profession and keeps me coming to work every single day, passionate about what it is that I do. It's helping other nurses develop their own superpower.